confirmation of coronavirus cases in our state. And there's no doubt that our communities, they look and they feel a lot different than they did just 1 week ago. Yet, amidst all those challenges and the closures and the chaos, I'm daily reminded of the goodness of Montanans. The AmeriCorps members who are displaced from their current service post are asking what else they can do to help Montanans. The teachers concerned about ensuring that their children are getting a quality education, even amongst the challenges of closures of schools. A distillery recently just is converted to creating hand sanitizers. They'll do 500 gallons next week and get up to about 5,000 gallons in 2 weeks. And starting out by providing that to first responders and hospitals. Tavern owner who I was speaking to, he's worried about his own future economic opportunities and viability. Yet he's told every one of his staff that they'll be paid for the next 8 weeks without regard to the closure. Through Facebook groups, Montanans are sharing resources and helpful information, as well as providing private ways where community members can actually request assistance. Montanans are then stepping up to the plate to provide that assistance. Other communities around our state, they're using volunteer organizations to make sure that those most at risk of this virus can still have access to groceries, prescriptions in a safe way. Many of us certainly read a story from this week about Browning Public Schools and the food service staff's diligent efforts in making sure that kids are still getting those school meals that they rely on. As one volunteer, Laura Hall, put it, in my experience, we've always been having each other's backs. When you deal with a crisis, you help each other. It's natural. Our kids are going to be fed, and we're going to feed them. Well, our state is much different than it was just a week ago, or even several weeks ago when we started really bolstering our efforts in preparation of COVID-19 reaching our state. We must not overshadow the countless Montanans who've stepped up to help others in this time of need. Montanans have always rallied together in times of crisis, and I'm inspired to see that same commitment to our communities today. There are two ways that together we're going to make it through all of this. And Montanans are already engaging in both of those ways. First, preventative measures through social distancing. And second, looking out for one another with our strong community ties. Now, we've taken several measures over the week to make sure that we're taking those necessary steps of prevention. With prevention, we can slow the spread of this virus, reduce the strain on our frontline healthcare workers. It certainly has required some difficult decisions, ones that I haven't made lightly, and I've done in consultation with healthcare professionals, local healthcare departments, and community members all across our state. Most recently, as of today, I directed the closure of dine-in food service and alcohol beverage businesses, as well as other entities that can draw large gatherings, such as gyms, movie theaters, and casinos. And we did that to curtail the spread of COVID-19. The directive begins this evening at 8 p.m. It expires at 11:59 on March 27th. So on the one hand, that's just 1 week. But set it for that date because at the same time the school closures are set to expire. Well, both of those dates may well likely be extended to the extent that I'm directing closures under my authority at the governor's office. Just for the predictability of Montanans, I want to have them all on the same timeline. That doesn't necessarily mean that everything would open up at the same time, but I think it's just for simplicity. So while the statewide closure announced this week, the directive says only 1 week. That's to get uniformity overall with other closures. As we see positive cases, it includes both younger and older Montanans, and in cases urban and now rural. I know that closure and these actions are imperative to protecting our friends and neighbors. It really is up to all of us to prevent the spread of this virus. And the sacrifices that we make now will help mitigate future action required to keep as many people safe as possible. We're certainly seeing a combination of cases that are both from international travel and some that's been social spread in Montana, like from the Board of Regents meeting. We're continuing to analyze the trends in the spread of this disease in order to take the best approaches to mitigate. So far today that the lab has confirmed 2 more cases. There's one from Madison County. It's a female in her 50s. And the Lewis and Clark County patient is a male in his 30s. The lab, it's still running tests throughout the day. We will provide a complete update at the end of the day once all the test results are finished. And we're still following the protocol of contacting local public health agencies when results immediately become available, so that way they can contact the patient and begin to learn more about the patient's history. That's why in some instances you might find out about cases prior to our complete notification of the day. In addition to actions that we took earlier this week, today we also extended Montana's payment and filing deadlines for 2019 individual income tax payers to July 15th. That's consistent with the new federal filing deadlines. So Montanans across the state certainly are already being impacted by COVID-19, and extending the deadline will give taxpayers breathing room without having to worry about interest or penalties. The Montana Department of Revenue will be lenient in waiving penalties and interest associated with late tax payments, and the department will work with with taxpayers on an individual basis. Now, Montanans who expect a refund can certainly still file now or soon to have additional income during this time. Yesterday, I also had issued a travel advisory for Montanans who traveled internationally, and I asked them to self-quarantine for 14 days after returning to Montana. And it's an extra precaution I'm recommending, especially as we know that Montanans are returning from spring break trips. It was also on the just recent heels, it wasn't coordinated necessarily on the announcement from the federal government asking U.S. citizens abroad to return home. In point of fact, like I heard from a Montanan who had been in the country, had gone through customs, had not received any information along the way from the federal government. So we wanted to take this precautionary measure, and by staying home after traveling, Montanans can play a key role in preventing any additional spreading in the communities. Yesterday, I also issued additional guidance relating to our public K-12 schools. And I do sincerely appreciate the teachers, the administrators, and school staff who are working through what's really challenging and unprecedented time to make sure that the needs of children in every corner of our state are being met. And I say that as a governor, and I say that as a father as well, watching my 3 kids doing their homework yesterday and today before I left for work. Collectively, we have to do everything we can to ensure that students are still able to receive that quality education and the services that Montana families rely on in the event of longer school closures. That's why I also directed that measure be put in place immediately to ensure that schools are utilizing this time. We closed them the start of this school week until next week to plan and really make sure they have it all together in the event that there are future closures. I think most districts across the state already have kids getting instructional learning right now, but wanted to make sure that they had that 2-week period to do so. also lays out some guidelines in the event the closures extend beyond March 27th that will ensure that services will continue. You can read or turn on the news or see everywhere across the country, there is a national shortage of supplies to a degree needed for COVID-19. And we're doing everything possible to overcome this challenge in Montana, secure necessary materials that will allow the healthcare community to safely test those who need it, and also have the personal protective gear for equipment for all of their efforts. So we're in the process, and even through this weekend, of distributing our state emergency stockpile of hospital PPE, as well as an inventory we recently received from the Federal Strategic National Stockpile. An additional shipment of N95 masks will be received tomorrow that will be distributed to local hospitals and emergency medical services units in the coming day. And we've also been doing some real good work and expect to receive some additional swabs as well. And it's the swabs that actually what you do when you're going to test. So thank you again, and I'll now open it up for questions. We implemented a new conference call system. If you'd like to ask a question, you can press *5. You'll be notified that your hand is raised. It'll be a little voice that you'll hear, not all of us. When we unmute your phone, then you'll be notified that you've been called on to ask your questions. So if you'd like to ask a question, if you raise your hand, you do that by pressing *5. If you've already received an answer to a question that you were going to ask, you can lower it by pressing *5 again. With that, be happy to answer questions.
Has left. Jody White.
Hey, Jody.
Has left.
Oh. Guess we'll have to figure out a way to get rid of that, how people are leaving too. Any questions? So did you unmute someone? Please.
This is Karen Stein from the Bozeman Daily Chronicle. I was hoping you could tell us what your thoughts are about changes to the June primary and kind of when decisions about that might be made.
Yeah, and thanks. We have heard from folks, and this really is, as I would say, a dynamic situation. I mean, when you think of that it was only 8 days ago, and even before we had a COVID case, that I directed or entered a state of emergency. So I haven't made any decisions on what we'll do with regards to the June primary yet. But as we get closer to that, and certainly want to give local officials and others those opportunities to prepare if it ends up something other than what we currently use. I'd also encourage people, though, once we get within the 60-day timeline, that you can actually vote by mail ballot no matter what, even if we don't make changes to the June primary. Other questions?
Governor Bullock, this is Nikki Willett from Yellowstone Public Radio. Yesterday you announced there are 3 new cases out of Yellowstone County. Can you confirm if those are from social spread, community spread, excuse me?
Nikki, I cannot right now. And that's one of the things that, we're working on as far as getting on the epidemiology side of it to really try to do the best that we can to figure out where each of these came from. But I can't confirm that right now.
Thanks. And
next question, please. There's no way to know who's open. Yeah. You might just, if you have a question, try talking because one of you has an open line right now. Next question.
Am I talking to me? Can you hear me?
I sure can. Thank you.
Hi, Governor. This is Tom Schultz from Voices of Montana. I wanted to clarify, I might have misheard, Montana tax filing is June 15th or July 15th?
July 15th. July 15th.
Thank you.
Absolutely, Tom.
Have there been any hospitalizations, Governor? And if there are, does that become part of the reporting process?
Will become part of the process.
Right now, we don't have anybody.
Not from Montana.
Yeah. So, Tom, it will become part of the reporting process. Right now, of the COVID-19 cases that we have in Montana, none of them are hospitalized.
Thank you.
Absolutely. Next question, please.
Can you talk a little bit more about the shortages of equipment and tests? Kind of what does it maybe like numbers-wise look like now? How many tests do you have, and how many are you expecting to get?
So, as far as the number of tests we have right now, we've tested about 947 people to date. The extant supply of tests, I don't know if we have right now. It's yeah, I mean, we still have, like, we're not running out of tests by any means, and there's, we're working to make sure that we have sufficient tests. It's also, and I explained that on an earlier call, it's both the tests, but then it's the materials around the tests. Like, it's the swabs that get the sample, as but an example. So we're actively monitoring this on a daily basis to ensure that we have those resources that we need, and continuing to look at the ways that we can make sure that we have ample resources. But I don't have concerns as of this date that, if someone goes in to get a test, assuming that they're symptomatic and their history shows such that they should be tested, the medical provider can agree to do that. It's not a shortage of tests that would limit the ability to have tests right now.
Has left.
More people for the state lab?
I'm sorry? What about
Are
more?
you planning to?
Or are we planning on hiring more people for the state lab?
Yes.
Right now, I mean, the state lab is running 7 days a week, and we started that last week, and we're by and large meeting the capacity needs. That could well change, but look, as in every area of this, we're constantly assessing both what the needs are and what our capacity and capabilities are. And there are indeed, in addition to the state lab, it should be noted that there are private labs outside of Montana that some of the samples are being shipped to by individual healthcare providers or hospitals. Other questions? Please.
Two questions, Governor. One, we're seeing cases rise across the country, and all indications are that we're ahead of it here in Montana. But in the case of, in an emergency situation, say 5% of the population needs treatment, is Montana prepared?
I think we're doing everything we can, both, literally assessing where hospital beds are, making alternative plans if we got to the point where our healthcare facilities were full. We have been doing a good job trying to both assess the needs. I think, when we announced the state of emergency, even before there was one case, we said, now's the time to plan and prepare, not to panic. And we're constantly doing that literally every single day. And we'll do everything that we can to meet the healthcare needs. And we're in close conversation with our healthcare providers all across the state.
As a follow-up, we MTN has received reports that a Montanan who traveled to Spain has died,
Has left.
has passed away as complications of
Conference
coronavirus.
locked.
Have you guys heard anything on your end from that?
So we haven't had anyone pass away within the state of Montana. Heard a rumor of that as well. Like, I won't ever confirm anything till I can get it through all of the channels. So, don't know yet.
Governor, some people on here are asking about courts, whether they'll be open or.
I don't. Did we do county guidance yet too?
We have not. I believe that there has been some guidance that has come out from the Supreme Court and the judicial system. And I believe it's posted on the website.
Yeah. Question on the phone.
Hey, this is Holly Michaels. Can you hear me?
I sure can, Holly.
Awesome. I was just wondering if you could walk me through a little bit of your thinking in making the decision to issue the closure order that you did today. Was it that counties around the state, that there were some that weren't doing it on their own, or was it once Montana hit a certain amount of cases, or did it spread around the state, or what sort of led you to do today versus earlier in the week?
Yeah, and earlier in the week, certainly some communities, look, every local public health department can take actions that they think are in the best interests of that county or community. And individually, I was even weighing doing this earlier in the week, but just thought that both it is the time to make sure that we have some degree of uniformity of closures. And we're also dealing with, like we were working on this before we got cases last night, but it's evident that it is in both urban and rural areas of our state. So a uniform closure order seemed to me, and after consulting with others, most protective of human health and most likely to flatten the curve of spreading along the way.
And one follow-up on questions that some other people had asked. I think we've all been kind of hinting around, supply capacity, PPE capacity, and testing, and hospital bed capacity, and understanding that it's hard to get exact numbers, that they're changing constantly, that hospitals have access to supply outside what the states are. But what sort of ways there for the state to let Montanans know sort of where capacity is at, if it's at an okay level, if it's reaching concerning levels, like what sort of, I understand there's tracking going on and that the task force and DS are watching that, but how will that be communicated to the state and people who live here if we get into sort of a troubled area?
Well, I think first of all, like in individual communities, when you speak of a troubled areas,
Has left.
we're pretty good at working together so that if like one facility didn't have sufficient, they would work even amongst themselves to try to balance that out. And I mean, it's no exaggeration to say that every single day we're both doing the assessments of how much PPE, as an example, that we have and what the supply chains are to get more. Sometimes that means making additional requests from the national stockpile, hoping they will get that. Sometimes it's reaching out to our neighbors in North Dakota who we know have some. And it's also going through private chains and private suppliers and finding out how much time it might take to get that. So it certainly is a dynamic and it's an iterative time in that respect. But we do have both testing supplies and professional PPE equipment right now.
Yeah. The only other thing.
And this is Greg Holzman, the state medical officer, Dr. Holzman speaking.
The only thing I would add on to that, I think people hear plan and think we have one plan. We're trying to say we have lots of plans in front of us. We're thinking A, B, C, and always thinking about if it goes this way or that way. And we're ahead of the game in a lot of ways because of learning from our colleagues that are in other cities around the country and even around the world. So there's a lot in place as we work forward and see where the virus goes. Our first goal, though, is not to have the virus here at all.
Did that answer your question, Holly?
Yeah, it did mostly. I think I'm just sort of, looking at, the public is asking a lot of questions about it, and, understanding without numbers is a little hard to gauge, but just trying to look at ways to inform them about, sort of where we're at, and trying to quantify it without, having numbers behind it.
Well,
Through that, but
yeah, and it's hard because I think for the press, the easiest thing is, okay, we have X number of kits, or X number of swabs. Like, secured a way to get 4,000 more swabs for the state that we just heard about today. That potentially is 4,000 more tests. It's one of these, though, that all continue to express concerns and have expressed concerns along with other governors about tests and supplies available and pushing the federal government to assist in us to get what's needed. That on the one hand we hear, well, get it through private supply chains, but often private supply chains are providing their goods to the federal government. So we need all the partnerships along the way that we can, but it is one where we are constantly assessing facilities all across the state, trying to get their sense of their PPE, making sure that we have testing supplies throughout the state, and that's where a state like ours, we can lean on one another and try to share some of the resources. But it's a hard, it's giving you a number of, I think roughly, if I can do the math right, like we will put out 16,000 new masks this weekend. And that's distributed to healthcare facilities and emergency medical responders all across the state. I'd say roughly 16,000 because I'm just kind of doing some calculations in my mind from what the stockpile was and what we at DPHH had, our DPHHS had. We'll continue to try to do that. Both individual hospitals are ordering through their supply chains, and we're trying to do the assessments of where can we all collectively help out to make sure all of us are in a good position.
are there any facilities in the state that you're sort of concentrating resources toward at this point? Just thinking, we've got Yellowstone, Missoula, and Gallatin all with 4 or 5 cases. Well, the first one in Helena here today, but Kalispell, other population centers don't have cases yet. Is there any sort of concentrating supplies in those areas yet, or is it still just sort of an even distribution, or how does that work if you're making sure that those testing abilities get sent out around the state?
Well, and the testing capabilities, again, because most of the states, unless the hospitals are sending it to private labs, come to us. It's making sure that there's sufficient swabs and the adjacent material in all of those areas. And now, like the mask distribution was based largely on population and service area. As we get more and more cases, and we may well get cases in those larger communities as well that haven't so far, Flathead County or Cascade County. I mean, there's a constant assessment of that, but that, we're trying to keep everybody with the degree of supplies that we can.
Awesome. Thank you very much for that.
Absolutely. What's that? We got it. Well, again, thank you for taking the time, and thank you, Montanans, for stepping up and helping out neighbors in need. And together, collectively, not only can we help prevent the further spread, but also we can, in what are challenging times, do our best to work together as one community. Thanks.